are. With your permission, we have about 22 participants online. I would like us to have some few more people join in, and then we can start. If you're okay with that. Prof, is that okay?
Yeah, please go ahead. I'm here too.
Okay, all right. So with your permission, participants, let's wait for a few more minutes for others who want to join, those who are having technical hitches joining, and those in the waiting room. Let's kindly allow them in and then wait for a few minutes to have some more participants, then we can kickstart. Thank you very much.
그 사람들은 정신력이라고.
Okay. Good morning, good afternoon, wherever you are once again. I think we are going to officially start the program. I'm just quickly going to run you through the agenda. We are going to have our opening remarks and then quickly move to an overview of the African Center for Digital Healthcare, what it's all about, what we seek to achieve, our objectives. After that, we are going to talk a bit about what digital healthcare is all about, so that for those participants who are not very familiar with digital healthcare, we can have a bit of idea. We are going to have a panel session, the first panel session. And then from there, we are going to move to the second panel session, which will talk about some policies regarding digital health care policy in Africa. We'll now have a question and answer session from our participants, and then we'll wrap up and then have our closing. And so for our participants, if you have any question, kindly put it in the chat box. We will collate all of them, and then we will have our panelists respond to those questions. Also, a bit of housekeeping. I just want to notify us that this session is being recorded and is live streamed on YouTube, Facebook. So you can invite others to join. You are kindly reminded to mute your mics to avoid any distractions. We are also on all social media platforms as Africa Center for Digital Healthcare and Policy Research on Facebook, Instagram, LinkedIn, and others. So you can kindly follow us on these platforms for future programs and collaborations, etc. Okay. So my name is Lavia Fuakwa. I'm with the National Development Planning Commission, Ghana. I'm a principal planning analyst and a resource mobilization and partnership officer. I'm also a senior fellow with the African Center for Digital Healthcare Policy. And I'm going to be your moderator for today. Without much ado, as I mentioned on our program, the first on our list, is welcome remarks by Ms. Hayon John. Ms. Hayon is also a senior fellow. At the Digital Healthcare Center. She's a policy analyst in the area of sexual and reproductive health, gender equality, and human rights. He's also been delivering various field experiences with UN NGOs in Southern Africa. Ms. Hayon is South Korean and she's very passionate about stuff happening in Africa. Ms. Hayon, you are welcome to give the welcome remarks. Over to you.
Honorable Professor Momodu Salam, valuable panelist, Mr. John Onosa, Mr. Edwin Asogun, Ms. Amna Abdul Salam, and Mr. Enoch Aburabi, respected scholars, distinguished ladies and gentlemen, welcome everyone, and good morning, good afternoon, and good evening, wherever you are. The Africa Center for the Digital Healthcare Policy and Research, which is ACDHPR, arose from the KDI School of Public Policy and Management, alumni-led SDG-focused evidence-based project. KDI School of Public Policy and Management has launched the KDI School Alumni Working Partner Program annually to accelerate positive developments to shape the world and pioneer the future. The Africa Center for Digital Health Policy Research has been selected as a part of the KDI School Alumni Working Partner Program in March 2022. To reduce health inequality, one of the empowered initiatives is to invest in digital health to make better health systems more effective and to provide universal health coverage, which is UHC. Digital health can bring the public health portals to provide transparent access to personal health records and contract with the health system. Digital health also brings equal opportunities for everyone through innovative and creative research and development. For example, 5 teenage girls from Nigeria, they have created an application called FD Detector that reads fake medications by coding and determining authenticity by using a medication's barcode to authenticate and verify its expiration date. Digital health for achieving good health and well-being and reducing poverty is a good initiative for everyone to work together from the ground. On the ground, digital health makes several pathways to deliver accessible and equitable healthcare services. And together, we must harness the same urgency and innovation to address the full range of challenges we face. No one else will do it, and it cannot wait. It must be us, and it must be now. Without these words, I welcome you and wish you all a fruitful discussion, and thank you for joining today.
Thank you very much, Ms. Hayon, for your welcome remarks. As she mentioned, digital health for achieving good health and well-being and reducing poverty is a good initiative for all to work together from the ground. On the ground, digital health makes several pathways to deliver accessible and equitable healthcare services. And together, like she said, we must harness that same urgency and innovation to address the full range of challenges that we are facing. No one is going to do it for us. We have to do it ourselves. It must be us, and it must be now. And thank you very much, Hayong, for those welcome remarks. Next on the list, I would like to welcome our founding fellow and lead researcher. He's contributed to research in integrated healthcare projects. He's also done some work on health impact on climate change. Dr. Festus Adedoyin will introduce us and give us a brief overview of the center, which is the African Center for Digital Healthcare Policy Research, the objectives and what we seek to achieve, and a bit about this roundtable. He'll give us an overview. So over to you, Dr. Festus.
Thank you. Thank you very much. I'd like to welcome everyone to this roundtable. The purpose of this roundtable is to accommodate the discussion around digital healthcare projects going on all over the world. We are trying as much as possible to understand and contribute to what the United Nations is doing in terms of SDG 3, which talks about good health and well-being for all. And one of the aims of this roundtable is to try to bring together stakeholders. So Africa is vital, is important in the conversation about global health. And so we try to bring stakeholders together from the industry, from academia, from government, and to have that conversation around where should policy be heading towards, particularly how can we support all of these stakeholders within the conversation. And so policy making, which is the heart of ACDHPR, this center, it brings a conducive environment. Good policy will bring good environment, which will make investment thrive. And one of the challenges that we see is the fact that, like many developing countries import a lot of things. We import cars, we import shoes, we import clothes from wherever it's been produced. But strangely, we also import policies. But then that shouldn't be the case. I mean, policies lessons can be learned from other continents of the world. However, policy should never be imported. And this is the reason why we started this conversation. First of all, to discuss the objectives in terms of all the purposes of having governments, having good governance, having good policies, but also to discuss the potential challenges we have, and not just keep talking about these challenges, but actually look for a way, a path forward away from these challenges. From this roundtable today, we will be publishing policy excerpts, which we intend to share across many African countries, across many local governments, federal governments, and regional governments across Africa. With this, I am very pleased that you're joining us. We have a very rich panelist, a very rich set of panelists, and we're very grateful that they've joined us today. And please stay tuned, and we look forward to hearing from our panelists. Thank you very much for joining us. Thank you.
Many thanks. Thank you very much, Dr. Festus, for those rich words. I like the part when you said, we are not just going to talk, we are going to find ways to address some of the issues or challenges that we are going to raise here. It is always said that Africa has the best policies, but when it comes to implementation, that's where the problem is. And so I'm very glad that you mentioned that we are not just going to talk, and we are going to go beyond talking. Thank you very much. So we are pretty much done with the introductory section of this roundtable. We are going to delve into the technicalities. And like Dr. Festus said, we have a rich panelist. I'm going to introduce them. And so we have Professor Momodu Salah. Prof is a director at the Center for Academic Innovation and a professor of teaching and learning at the Faculty of Health and Life Sciences, School of Applied Social Sciences in the De Montfort University in the United Kingdom. Prof, you are most welcome. We understand you had an emergency, but you still made time to be here for us. We are very grateful for your presence. Thank you very much.
Thank you.
We also, second on our panel is Mr. Edwin Ojogun. He is the country director of the Co-Innovation Center. He's an entrepreneur, investor, and business manager with a significant amount of experience in startup programs and partnership management in Nigeria, Ghana, United Kingdom, Germany, and many other countries. So he's responsible for managing its incubation and acceleration programs at Eco Innovation Center. With these few words, Mr. Ojogun, you are most welcome to this roundtable. We are grateful for your presence.
Thank you so much.
Okay. Third on our panel is Mr. John Jehu Onuja. He is an industry expert with experience working with Amazon, managing a team of associates. He currently is the portfolio manager at Theo Ventures, an idea incubator based in San Francisco, United Kingdom. Mr. Onuja is also in the digital health space. You are all welcome, and I would request the participants to give you a virtual clap as we welcome you too. So by way of reminder, I'm reminding you too that we are streaming live on Facebook, YouTube, and you can invite your friends to join us. We are also on all social media platforms as African Center for Digital Healthcare Policy Research, and kindly follow us. So, Prof and my other panelists, I hope we are ready to delve into our issues. Prof, should I start with you? According to World Health Organization, for instance, digital technologies are, an integral part of our daily life. The world's population has never been more interconnected with regards to digital technologies. Innovation, particularly in the digital sphere, is really happening at an unprecedented scale. So, Prof, if you can kindly share with us what's going on across the continent, your perspective of digital health. You can also highlight some of the challenges as well. And after we can come to some of the innovations in the digital healthcare space in Africa. So, Prof, respectfully, yeah, welcome.
Thank you, Lovia. Thank you so much for the nice introduction. And I also want to thank Dr. Festus and Mr. Usman, Gako, and all wonderful people who put this program together. Yes, I did have an emergency, but I couldn't miss this wonderful program because it's quite important, it's quite pertinent, and it is something that needs to be addressed. Just to make a disclaimer, first, I'm not an expert on health matters. I'm a lot into teaching and learning and disruptive pedagogy and development, but these things are intertwined. So that's where I'm coming from. I mean, I think when we talk about the problems in Africa, we can talk about health, we can talk about governance, we can talk about conflict, we can talk about food security, we can talk about, a lot of different things that are part of an ecosystem that actually mutates against Africa. So when we talk about health, and we look at the facilities that we have in a lot of our hospitals, in a lot of our health facilities. I spent the night yesterday in a hospital. I mean, I think for over the past 3 days, I spent 2 of the nights in the hospital. And it just brought things to me. And they're very, very basic things that can be done, that can be digitized, that would make life easier, and that are not done. And sometimes you wonder whether there is a further need to decolonize ourselves, not only in terms of education, but in terms of the health, in terms of the ministry, in terms of the administration, in terms of the judiciary, which is not happening. And I think a lot of younger people, the younger generation, who are more tech savvy, who are global cosmopolitans, who understand things, who understand the power of the internet. And when you look at the fact that operations can be done remotely, without the presence of the expert on the ground. I mean, to what extent of these facilities? But maybe we're jumping too far. Maybe it's the fact that people are still dying because they cannot have ambulances to take them to the hospitals in time to deliver children. Maybe the fact that a lot of our medication is also quite fake and not fit for purpose, and we don't even have basic, processes in a number of countries to actually detect and deal with these things, which has massive implications on the health of our populace. Maybe even basic things as having adequate doctors and nurses and trained personnel. Maybe these are the first challenges, but digital health is it's a way in which we can address some of these issues from any part of the world, from developing very, very simple things that can be tested in real time and fed back. So, I mean, I just wanted to open with that and say, maybe we're giving too much credit to the current system, because it shouldn't be like that. Because there's so many opportunities to innovate, to reverse innovate, and to make the health system a lot better than it is. And as somebody who spent 2 nights over the last 3 days in a typical hospital, I can tell you horror stories. But also, I'm actually kind of like motivated by the hardworking staff in some of these places who are doing, going above and beyond the call of duty to make things happen. So, Lovia, I'm happy to open with that and then wait for other panelists to share their thoughts, and also for the audience to actually come back to us as well.
Yeah. Thank you very much, Prof, for that insightful introduction. I agree with you. Absolutely, I agree with all that you've said. And of course, we cannot leave COVID in this conversation. Like you said, there are some things that we could do with digitization, especially with the time that you spent at the hospital. I agree with that. By way of opening, as we are all opening or giving introduction, Mr. John, could you also give us a brief introduction about digital healthcare and what you also think about the whole thing, your perspective about it? Mr. John, sorry. Yeah.
Okay. All right. Thank you. All right. I'm really excited to be part of the roundtable discussion today. Thank you to Dr. Festus for inviting me to the roundtable. Disclaimer as well, I'm not a health expert or professional in any way. My background is more in economics, international economic development.
Oh, okay.
Where I have a master's. But again, healthcare is part of, development economics. It's a core part of United Nations Sustainable Development Goals, World Healthcare Organization, in terms of affordable healthcare for all. It's a fundamental human right. So I think everyone in that sense is a stakeholder. In terms of industry experience, I manage portfolio investments with Trio Ventures, based off in San Francisco, California. And it's a space we're looking to get into within Africa, because the idea of digital healthcare is still significantly behind the expected levels in Africa. A major challenge, I would say, there's problem of access to healthcare. It's a big problem, which could come from infrastructure. The professor rightly mentioned there's a lack of infrastructure, a poor infrastructure set up in Africa. And it could be from ambulance to, geographic challenges such as the clinic being very far away, the nearest clinic, what's the proximity? And in the advanced country, even if you have an ambulance, it takes just a few minutes drive, to arrive at the hospital, and they get timely intervention. But a lot of Africa, you can see clinic is either really far, so you have that proximity issue. There's infrastructure, there's human resource problem. Again, you mentioned, nurses, pharmacists, doctors. How much of that do we actually have, available? So there's also economic dimension to it. We are producing or graduating nurses, healthcare experts. I think, for those of you based in the UK, you're very familiar with the capital flight, and there's also a lot of, brain drain in terms of healthcare experts who are living in Africa for greener pastures, not just in the UK, but the advanced, economies. So that's only going to, make it tougher, right? So, and then the economic dimension to it is also the incentives, because then human capital is an investment, and what is the return on that investment? And so that's where you have the government, coming in, making a system that works for a private sector that thrives. So now, given all of those challenges, we know the government alone cannot provide all the solutions, and so that's where the private sector comes in. From our perspective at Your Ventures, digital healthcare, is a solution that has to come from, the private sector, that has to be driven largely by private sector investment. So there's innovation in terms of startups that are bringing ideas that solves healthcare challenges. And so for us, we're looking to get into that space, starting with Ghana, where we have a startup called Body by Technology. And so we're looking to bring container care, healthcare that is cost effective using a container model instead of physical building infrastructure. And then to come equipped with all digital healthcare facilities. Achieving that requires access to data and healthcare records, which is also a big problem in Africa, in most of Africa. So these what called wearable devices that tracks, individual health information, and then make that information available to the doctors or to the experts who can detect the ailments, all right, that people have, and providing timely solutions. So there's a whole lot of challenges. So from the industry perspective, I feel like we can bring unique solutions to the table that complement the efforts of governments across Africa. And so I think I might just stop there. That's a brief overview of some industry approach that could solve those challenges.
Okay. Thank you very, very much. That's a good one. I like the part when you said we need a government that provide, private sector should come in. But of course, we need a government that provides systems that works for the private sector to thrive. We're having some awareness creation on the Sustainable Development Goals in Ghana. And then wherever we went, people ask us, what is the government doing? Then we also ask them, what are you doing to help? It's not just about the government, it's about all of us. That's what, we need partnership. I think Goal 17 talks about partnership for the goals. We need to partner. And of course, that's where the private sector also comes to being. These are some of the ways that we can, achieve the goals, and especially Goal 3, which talks about good health and well-being. Thank you very much, Mr. John, for those wonderful words. I'll definitely come back to you. With few words, Sir Edwin, can you also give us a brief introduction about your perspective about the whole digital health issues? Over, sir.
Okay. So for me, working at the intersection between government and startups here in Nigeria, and even across a whole lot of countries, I think digital healthcare innovation is something that is really taking flight. I mean, we're talking about, even though, in my opinion, it's still one of the least funded areas when it comes to the percentage of funding that is coming to African startups. If you compare what's coming to fintech and other techs, to health only takes like about 5 or 6% comparatively. And even if you do look at it, you see that there's not really enough drive and push to really create these solutions that are beneficial. Personally, I'm always really biased towards healthcare because I feel like there's nothing you can build and there's no innovation you can drive if the community is not healthy. But luckily for us here in Lagos State and even across Africa, we are seeing that government is paying a lot of attention towards really implementing some of these things that will drive e-health. I mean, infrastructure, policies. We've seen the government really take a keen interest in data, mandating that hospitals should begin to move from a physical collection of hospital records to digital collection of hospital records. So now we're championing in collaboration with NICTA, federal government agency of technology. So this is the benefits for e-health care is kind of like, it's very, very obvious. It enables us to reach more people, and the quality of care will definitely be improved. We are seeing it everywhere, and across the board, we are basically seeing, and of course with the new technologies that are coming up with 5G and with IoT and all those blockchain technologies, and the opportunities are beginning to become more and more. They're already endless, but of course, when we begin to see beyond that scope and see things that we couldn't even see before. I mean, I still read up on the new kind of technology that some guys in San Francisco, was it Hong Kong, did about this robotics using a kind of like what they call a soft robot to be able to move around your body and remove things that the baby has swallowed by accident. These are the kind of crazy innovations that are coming up, and I'm sure within Africa, with the right investment, with the right policies, with the right support from government, which we are getting, we can maybe get to that point whereby these solutions they won't just be imported to Africa; they'll be built right here in Africa.
Yeah. Okay, wow. The conversation is getting interesting already. Thank you all very much for your contributions. And for our participants, I'm sure by now, if you're not very familiar with digital healthcare, you have a bit of idea. You're also reminded to put your questions in the chat box. We will collect all of them and have our panelists respond to them. So I'm back to Mr. John. I'm not following you, but I want to ask you this question.
Sure.
Could you, from where you sit, could you give us some experience on how digital health can be a tool for strengthening the health systems across Africa? Prof, I'll come back to you. Can you describe how digital healthcare can be a catalyst for, greater health equity, and how these innovations can increase health outcomes? Let's talk about drug delivery, e-medicine, and all those kind of stuff. Can you share something about it?
All right, thank you for the question. So looking at the healthcare in Africa, I think there's something that is common to most of the healthcare. Like I lived most of my life in Nigeria. I've lived in the US. I'm in Canada now, so you kind of see the difference between the healthcare in Africa and in an advanced country. Now, the data also shows the disparity. If you look at the per capita healthcare expenditure, on average, how much does each household spend on healthcare? Right? It's a huge margin between $10,000 in the US to less than $100 in most African countries. The 32 of the bottom 50 countries per capita healthcare expenditures are from Africa. So in essence, Now the poor healthcare outcomes, it doesn't just happen, so it's priority, right? How much the investment actually goes into healthcare. So now, so the issue of access and cost, those are two key issues. So if people can access the solutions, and if it's not cost effective, in which case it's available, but it's not accessible to the average individual, then again, it's not going to be effective, right? So now for digital healthcare, where it comes in is that if you look at technology, so when cell phones first came out, so they were really expensive, like data accessing internet was really expensive. And but over time, as the technology grows, the cost drops significantly. So if we're looking at digitalization in terms of data, Edwin mentioned physical data collection in health in a hospital. Now, so it's all moved from hospital A to B. All of the records are in hospital A. Hospital B, if it goes there for emergency, they don't have the health history, right? They don't know what's wrong with that individual. You have to rely on asking questions. So now, if those electronic records are available, regardless of where you're going for healthcare or receiving healthcare, then you will immediately know, if that individual has allergies, if there's an existing history of pre-existing conditions that need to be taken into account to receive that timely intervention. And so where this solution comes in is attract investment. There are a lot of startup ideas, there are a lot of people. So the knowledge is local, right? The solution is local. Some of us are in the diaspora. And so for me, I believe the key to it is attracting, again, have the knowledge, either for health experts or in the private sector industry, bringing investors to Africa to invest in solutions, innovative solutions that drives down cost and improves access. So one of it, from what we're trying to do at Body by Technology, starting off in Ghana, with our pilot, Dr. Festo is going to be involved in a pilot study for that intervention. We're collaborating with companies, right, corporate bodies in Ghana, the government, agencies, healthcare professionals, to understand what the local challenges are. Because you can't sit here, in Canada or in San Francisco in the UK and find solutions to problems happening in Lagos or in Ghana or in Kenya without involving the locals on the ground. And so that collaboration is key. And then the technology could be foreign, but again, with local content, with local knowledge, they'll be able to find effective solutions. So I think digital healthcare can bring some difference in terms of making it really accessible and cost effective through a lot of collaborative effort. And then, so that's something we're looking to, to start off in Ghana and then eventually evolve to the African countries. And there's a lot of, scope for so much investment in that area across all of African countries. And that can only improve the outcome for governments. Again, we depend so much on government in African countries for everything from employment to food to infrastructure. But what they really need is the enabling environment, the infrastructure, good policies, right, that encourage investment. The ease of doing business is really poor in Africa. So those are some, challenges that, if addressed, could make investments easier for us.
Oh, sorry, I was muted. And really, collaboration is key in this whole process. We really need collaboration in this. So there's a question, and let me just highlight it so that we can think about it while I call Prof. So Sharif is saying that there's no doubt digital health comes with enormous benefits, how can the inequality that it comes with probably be solved, especially with regards to access in the rural areas of Africa? So you can take notice, and then I'll come back to this question. So back to you, Prof. Prof, do you have anything to add from where you sit with regards to some of the tools that can help strengthen our health systems across Africa? Over.
Thank you, Lovia. I just wanted to share some examples that might not be direct to health, but actually engage around the process of innovation. In my part, I've been trying to do a few things. One of the things that I've tried to do was to set up a development hub in a village in the Gambia. I mean, I normally live in the UK, so I've lived in the UK for the past 24 years, but currently I'm in the Gambia. I'm here for a week. So, but I have done a lot of work in terms of innovation like that. So this hub was all about how do we reverse innovate, how do we develop disruptive pedagogy and action to solve the poverty that afflicts our people. And one of the things we did was just to set up this development hub where we develop Africa's first solar power taxi service. We were looking at the fact that as much as 20% of some GDPs in countries are being used to import fuel. Nigeria, we still have a lot of fuel being imported despite the fact that Nigeria produces oil. So I cannot understand that conundrum. But this is happening all over Africa. And I'm just thinking, okay, I got an electric vehicle from Nissan through a partnership arrangement. And we tried to set up Africa's first solar power taxi service so that we can actually show people, but also look at how we can bring our young engineers to actually develop these like vehicles that will emission, that will harness the solar energy, and that will also give employment, and that will also kind of like be ahead in terms of what can happen in some African countries. So this was something that was simple, not waiting for people, but being able to tap into big global bodies, but also being able to sell them a vision, being able to engage them, but also being very clear what they can get out of it. That was a simple one. Right now, I'm here in the Gambia because we got a money from the World Bank to look at setting up a new University of Science, Engineering, and Technology in the Gambia. And if you look at a lot of our universities in a number of places, they focus on teaching reproducing knowledge, what Paulo Freire called the banking concept of education. They're not really interested in functional knowledge and be applied for social good. And as part of this new university we're setting up, I'm leading the project from my university's point of view, which is Damonford University in the UK. And we're also working with KNUST in Ghana. And one of the things we're doing is actually making sure that whilst the students, they get a degree, a BSc in civil, mechanical, and electronic engineering from KNUST, they will also get a certificate in innovation and entrepreneurship from Damonford University. That is going to be in that sense, so that we don't only produce engineers who actually can reproduce physics and all these engineering programs, but not able to apply it functionally to the lives of our people. The same thing that we're doing, that we're setting up an incubation and innovation hub in the as part of this outfit as well, so that while students are studying, they'll be also able to engage in the innovation program, so that product development, product design, applying social good principles to it would actually happen. At the same time, they will also be able to get into taking products to market in terms of, brand development, in terms of unique selling points, in terms of a business strategy, marketing, communication strategy, and be able to actually impact on the lives of people. So that is a space. So when I spent at the university, the innovation hub, and then the focus on decolonizing the curriculum by injecting and an incubation hub. It is to create the space, to create the environment, to create the tools, because we made sure that we're spending at least 200,000 to actually kit up the innovation hub, so that they will have our students will have the latest equipment that they can use to innovate and to work with people, both in terms of product development, but also in terms of taking products to market. When we did the Mandua Development Hub that we did in the Gambia, we didn't have any money, and the focus was building it ourselves. So we were able to, about 60% of mangoes, some people would argue, get rotten in the Gambia because they cannot be canned, they cannot be conserved or preserved. But we were able to develop these solar dryers and tested them. We were also able to use these compressed air bricks machines. The air room will cost about $3,000, but we were able to build one with our local engineers for about $400. So I'm just trying to show, and the solar taxi is the same. I've met with the students from the new university yesterday. I said, I challenge you to create your own electric vehicles that would be fit for the African environment. So, and if we look at the newest project I'm having, I'm setting up a Catalyst Academy. And one of the things I want to do is to set up like a plant and herb research lab. And I'm working with people in the UK and in the Gambia to set this up. We've started the foundation and started building this project. It's mainly coming from my pocket. But what we're trying to do, for example, people say that mango leaves, when you boil them, they're the best for anti-tetanus. So now, if that is the case, let's apply scientific knowledge, Western knowledge, whatever you want to call it, to test this out. We have a lot of African remedies that we can use, that we can test out and use science to scrutinize it. So basically what I'm saying is, like, we know the health of our people. Malaria still remains a problem. You know, what can we do about malaria in terms of its treatment, in terms of it's kind of like preventive measures using digital. Almost every single young person has a mobile phone now, and access to that kind of thing has never been like that before. And we can use these things. You know, if we're talking about studying the population, tracking people, if you're talking about not even having the capacity or the equipment or the qualified staff, you can do some of these things online. And you can work with people. So what I'm saying is, like, there are so many spaces where they're working with international bodies and national bodies to actually bring about disruption, or actually starting something and working with the community to travel at their own space. So, I mean, I know I've been talking a lot, and if you started me, Lovia, on this topic, and I can just go on forever. But I think these are the same principles that apply. Concept of
Yeah. Actually, I didn't want you to stop because I was enjoying it. I was really enjoying it. I didn't want you to stop. Thank you very much, Prof. That is really interesting. And there is a question in the chat asking about roles and resources for digital healthcare educational training. So maybe in your last words, you can speak a bit about it. I hope I'll see you when you come to Ghana with all the projects that you are doing. I mean, with Care University and others. I'm glad that we are not just talking, but we are, I mean, working and putting some practicalities into all that we are doing. Thank you very much. I want to acknowledge all the participants online. We are grateful to have you here, and we hope that you are enjoying the conversation, because I am really enjoying the conversation. Just to follow up, Mr. Edwin, we know that Africa is a wide continent, and I mean, not all the economies are equally prepared for digitalization in healthcare. We can say that some are doing well, I mean, that others or other African countries can emulate. So having in mind this realm, and from the government perspective, how would you describe the progress of African economies in terms of digitalization in healthcare, and which ones do you think some other African countries can emulate? Over.
So I think the biggest challenge that we have in Africa, really, especially when it comes to healthcare and building healthcare solutions, is that we don't understand that there's a core principle for building innovation, which is that you need to define who is paying for it. And the person that's paying for it needs to be able to afford to pay for it. So we have a situation whereby when we talk about healthcare innovation, talk about budgets, and talk about government spending, and talk about a lot of things. Yet the top in countries with the most out-of-pocket spend on healthcare, you have African countries that are little all over the place. Then you now begin to ask yourself, are we really creating an environment for innovation to thrive? I mean, if you look at the more advanced economies, you see that insurance is a big player there. Everybody's insurance coverage is from like 50% and upwards, whereas in Nigeria here we have like what, 3% or 5%. And I do feel like there's always going to be disparity in the advancement of the digital healthcare technology when you have countries who have vastly different budgets. I mean, I know that the spending of South Africa on their healthcare it's more than Nigeria's total budget. I mean, so when you see those kind of numbers, then the only leveler we have is kind of number of people you have. And the only way you can be able to weaponize such numbers is see there's an effective insurance infrastructure. I mean, luckily for us, we are getting to the place whereby fintech is really taking that, launch in bringing everybody together, giving everybody a face, right? Giving everybody a bank account, whereby we can be able to layer some of these solutions on top of it, right? But I do believe sincerely that by the time we get to that point whereby Africans on average have like what 60%, 40% covered, 30% covered, that gives an avenue for people who have genuine solutions in healthcare to be able to build, because they are rest assured that people are available that they can pay. So I like what South Africa is doing. I like their approach. I like their investment in healthcare. I think that they have a model that we should all imbibe. Nigeria too Nigeria is way behind, but Ghana too has a very relatively strong healthcare system, and I'm really, really proud of what they're doing there. I mean,
really?
Yeah, I'm plugged into your health tech space, so I know what's coming up in that place, and I'm really, really, for a small country, you have big ideas, but that's fine. So really, I think that infrastructure has to play its part in developing healthcare, financial infrastructure, fiscal infrastructure. And when that does not exist, what are the ways that we're looking at in weaponizing the current technologies to be able to achieve goals in ensuring that everyone has access to not just healthcare, but quality healthcare and quality medications. We're making some progress. But I think that, again, the leveler is really who is going to pay for it. And you can't ask people to pay for it because people just can't pay for healthcare. It's the standard. It's a well-known fact that people paying for healthcare doesn't work out in any economy. Then that comes down to insurance and how I think maybe the kind of policies that our governments should be looking at, or how maybe some of them are looking at it, and maybe some governments should be looking at is how can they create an enabling environment to ensure that more people are covered by healthcare insurance, either through agency networking, either through their banks, schools, community engagements, traditional rulers, anything. How can we get more people covered on healthcare? And I think when that is done, we see a really big upsurge in the adoption, and those creation and adoption of digital healthcare solutions across the board, regardless of the budget or whatever size of country's economy is.
Okay. The conversation is getting interesting. But there's going to be a second panel session, and we may have to wrap up. So I'll give us the chance to, say a few words. There's another question to all discussants, and I'm sure we can, in our last words, we can just bring that up. So this is going to go for all of us while we wrap up for this session. For the last session, we can talk about what are some of the ways that we can promote digital healthcare in Africa. And I think that it corroborates the question that Sheriff Ibrahim has put in the chat box with regards to pandemics. So he said that we can't leave COVID-19 in this conversation. So he said COVID-19 has changed a lot of things and opened up a lot of opportunities. So all discussant, how can we leverage digital health moving forward so we don't go back to previous ways of doing things in our various healthcare system? So we say that if we keep doing the same thing, we will not see any change. So I agree with you. What are some of the ways that we can leverage on to change the new ways of doing things? So I'll start with Prof while we wrap up this session. I know that with this, sector, especially with digital health, we can go on and on, but we are definitely going to come back again and discuss this. So while we wrap up, Prof, can you please highlight some of the ways that we can promote digital healthcare in Africa with regards to pandemics, epidemics, and others?
Thank you very much, Lovia.
How can we leverage digital health moving forward?
Yeah, I think for the biggest issue for me is the infrastructure. That is the health infrastructure, also to do with the personnel, also to do with research that is funded, research that is peer-reviewed, research that actually is transparent and has got properties of reproducibility. I think these are important because without the infrastructure, because you go to some of the hospitals, you go to some of the research facilities, and sometimes, most of the public health ones that I've encountered require a lot of work, a lot of areas of development, but I haven't been to every African country, so I cannot generalize. But the few that I have been to, what I have seen, actually sometimes is, and the staff work really hard to make things happen, but they just don't have the resources, the facilities, the medication, the support that they need to make it first class. So that's important. The research and the culture of research that is funded, that is peer reviewed, that is transparent, that is reproducible is important. But also, I think, corruption plays a very big part about what happened to the COVID money that was generated during COVID and all other kinds of funding that actually suddenly starts to grow legs and walked away. So transparency, accountability is important, but also we need to be able to get communities to take action, to hold others accountable. So these are just some of the few things that can be done from my perspective.
Okay, all right. Those are wonderful. Really, research is key. We can't leave research out, and it's one of the key objectives of the African Center for Digital Healthcare and Policies. As our name suggests, research is one of the key things that we are undertaking. So thank you very much, Prof. We are definitely taking that into consideration. Okay, now, Mr. John, wrapping up our last words.
Okay.
That's some of the ways that we can promote digital healthcare in Africa.
Yes, thank you for the question. So now I'll tie that to one of the questions from Sheriff, where he was talking about these two healthcare outcomes. Said, how can the inequality that will come with it be solved, especially accessing rural areas of Africa? So, and then to the previous question on best case or examples in terms of African countries that have been successful or are doing something right, which could be applicable elsewhere. So now looking at Ghana and what we're trying to do there, but by technology. So that was one of the questions that actually came up, right? So we had a team in Ghana that had meetings with healthcare associations in the Ministry of Health and different government agencies over there. And part of the question was, someone comes from a rural area and where they're talking about digital healthcare, there's no internet or stable internet service. So now how can that solution work in such an environment? So now the government response to that was that if there's a mobile service provider in one area that has quality internet whereas you have another company like Vodafone or MTN doesn't have coverage within that area. Now, so if you're subscribing to MTN, then you might have a challenge accessing quality digital healthcare in that environment. And so there's a law where the government makes it possible for you as a subscriber to have access to the service provided by the other company, even though you're not subscribed to that service. Now, so it's not something that was obtainable before, but the solution we're bringing on board requires access for everyone. And so looking at the rural areas, that could be a solution where, regardless of what service you're opting for, there's a collaborative platform, by the whole telecom industry to provide a service, setting profits aside. And so the government making that law or that policy, encourages again, private sector investments where you don't really have to worry about subscribing to multiple services, right? And then another solution could be data, right? So if someone is unable to pay for data or internet, then how can they actually access those solutions, again, in terms of cost? So again, private sector, there are innovative solutions we can bring around that. And so we're looking at, bearing the cost of data for people to access healthcare, the apps that require tracking of their health outcomes. And so they don't have to pay for that, the company pays for that. But again, that requires a lot of technical collaboration between the telecom companies and the startups. So there are smart ideas. They can, bring those kind of solutions. There are existing challenges, again, from transportation to the healthcare solution itself. So there has to be a lot of thought process, put into the solutions, again, to make it accessible, because otherwise, it's not going to be efficient. So can you appreciate that question? And I feel these two healthcare have its challenges, adoption, the literacy, number of people who are unable to utilize technology, right? So you have healthcare institutions, what's the knowledge transfer in terms of producing graduates who are ready to actually utilize those systems to provide better healthcare. So, and that's where I think Professor mentioned that the approach coming from a healthcare institutions. So it's a very comprehensive solution. We're not quite there yet for most African countries, exception maybe South Africa and a few, like Edwin mentioned. I think their per capita healthcare expenditures over $1,000 for households. Again, disparity between that and a lot of African countries are just like $50 or $40. So there's a lot of work, a lot of gap to make it inclusive, and I think that's the challenge and the next step for us.
Wow, thank you very much. Yeah, of course, South Africa, Rwanda, and some others, we are definitely going to get there. The others will catch up, definitely. Thank you very much, Mr. Noja. I know the conversation is getting interesting, but we're also dealing with time. Mr. Festus, I know your hand is up. Could you kindly put your question in the chat box? We are going to collect them for the panelists to answer them. I'm sorry we are behind schedule and we want to move forward. I thank you very much, Prof. Noja and Mr. Edwin, Mr. John. We are very grateful for those insightful discussion. I bet that we've taken a lot from it. We are now going to move into the second session, that session is going to talk about policies surrounding digital health in Africa. And I'll hand over to Miss Naomi, who will take us through the next round of panel discussion. Thank you very much, Naomi, and over to you.
Thank you, Loria. Last time I checked, I was still in.
I'm sorry.
Yes, so thank you everyone for being here, and I hope like we've been able to take something away from the very first session that we've just had. So we're moving on into the second session where, okay, we've heard from the other side, from the people that are in the field of digital health and what their experiences are, even if they're on the fringe or if they're actively working in that space. So now we want to hear from the government side. We want to see, okay, everybody's mentioning in Africa, the whole system is not encouraging, is not built for this, is not supportive of digital health improvement. So we want to hear from panelists that are on the other side of the divide. So we have two panelists for this second session, and I will quickly introduce them. So our first panelist is Ms. Amna Abdulsalam. She currently works with the National Agency for the Control of AIDS in Nigeria as a public health fellow. And she's currently the program officer for the Global Fund to Fight AIDS, TB, and Malaria grants. And on our second panelist, we also have Mr. Afolabi Enoch, who is a partnerships manager at UTIVA. So he has experience in the tech space and probably engaging government in policies that will allow tech to improve. So we're just going to have these two panelists give us their own opinions and their own facet of the issue that we're discussing, and then we'll continue with how the conversation progresses. So first up with Ms. Amina. Thank you for joining us today. So we've heard from the first session what digital health is, what the space entails, how Africa as a whole is set up to currently deal with it or improve. So just want to ask, like from the government's perspective, like what's the government's current view of digital health as a whole? Is it something that is part of their plans? Is it something that you're not yet considering, or is it something that is still in its infant stages? So I just want to hear what you have to say about that.
All right. Good afternoon, everyone. I hope everyone can hear me. My name is Amna Abdulsalam. Like Naomi said, I'm a program officer for the Global Fund, working with the National Agency for Control of AIDS in Nigeria. So it's a government agency. So my experience is limited to Nigeria, but I have done research on other West African countries and Southern Africa as well. And so I can go right ahead and answer Naomi's question about where we are as a government. I would like to put out this disclaimer that I'm not here representing or on behalf of the government in any capacity, and all views expressed here are my own. So the government is actually very invested in digital infrastructure and digital health. And they're very open to collaboration, and we see that in recent years. In the continent of Africa, actually, over 60% of countries have a national digital health strategy, whether that is a standalone document on its own or it's a part of their health strategy embedded in a section. And that 60% is 60% active. So the rest are either lapsed or they don't have a digital strategy at all. So we are seeing great strides in moving towards wanting to have the conversation around digital health. This is very important because a lot of the issues we hear about government is that the government takes too long to get on board with things until everybody's already there. So we're seeing that push and that conversation. And another big thing that has really pushed the conversation for digital health was the Ebola epidemic was actually a very big turning point for a lot of West Africa. And that's where we saw the emergence of the Africa CDC and the Africa CDC Training Institute. So I believe that was launched in 2016, 2017. And since then, Africa CDC does have mass surveillance programs and educational opportunities for a lot of African countries to invest in, and for government workers and agencies to utilize and set up systems for mass surveillance of infectious diseases, which is actually, I know there was a question earlier about this around COVID. It was actually one of the things that has really supported COVID surveillance, even though African health infrastructure on the ground is in itself weak. We are seeing a lot of digital surveillance and digital equipment on the ground with the government and with government facilities. So that's really, really good. Another thing that we're seeing a lot of recently is investment. So even though one of the issues plaguing a lot of African countries is that there is no sufficient health budget. A lot of countries, their health budget, their health allocation in their national budget is less than 5%, which is significantly below what is expected in WHO guidelines and what was signed on to reach the Sustainable Development Goals for health. But in recent years, African governments have been leveraging on investments, especially from China and Europe, where they are pushing for large-scale infrastructure building. Even recently, in the wake of COVID, Nigeria is funding a lab management information system to centralize all of the government and federal labs in the country so that there is cohesion around testing of mass infectious disease and the likes of that. So although on ground, the reality hasn't translated directly, there is conversation in the government spaces around going towards there, working with investors and private partnerships. And on the government end, what we would like to see and what we would certainly start pushing towards is government taking ownership of these things and sustaining these things, not just depending on private investments. Because one of the issues we face is with the wave of tech and fintech companies, we have a lot of tech companies that are, especially since 2020 and the COVID pandemic, are trying to tap into the health space. You're seeing electronic health record system. You're seeing mobile health technology coming out. So we're seeing a lot of that from private investors. But the issue is if there's no central unifying body, then things are being replicated. This data is not being recorded. It's not being reported in a public space. Because as a private company, your obligation is really to your stakeholders and for your very own PR, as opposed to having like a unifying database, a unifying place where everyone can go into and say, this is what we're doing as a nation. So I think that answers the question.
Yes, so thank you for that, Amna. So I just want to quickly go to Mr. Afolabi. I know you're not from the government, from your profile, it says you're an industry person. So I just wanted to not necessarily ask you that question in the same way, but just from your own perspective or your own experience with dealing with government policies when it comes to innovating. So I just wanted to get how you were able to navigate that space with regards to government policies around innovating. So if you have anything to quickly add to that, we would really appreciate that.
All right, thank you very much. Please confirm if you can hear me clearly. I want to be certain my headphone is coming out.
Yes, we can.
Fantastic.
Yes.
Okay, great, fantastic. So interestingly, one key path to digitizing the healthcare system is the talents that drive it. And you cannot underplay the need to educate and upskill the talents, to be able to make the most and optimize the system that is being built and being invested in, and possibly also scale it. What you typically find is there is a separation between the innovators, I like to call them the innovators, those who sit down to try and design what we think is the next outcome of what to invest in, and the regulators, and even possibly the amount of support that comes in, for example, in the nature of data that is accessible for research on how to approach the development of these solutions. There is a whole lot that is involved that needs to actually be invested in when it comes to upskilling and educating on the approach of innovation and how to make the most of the reality of different locations. So I'll give an example. Recently I had the opportunity to speak to Dr. Uche without saying his surname. Had the opportunity he worked on a project that was targeted at beneficiaries in Makoko area, and apparently I had observed the pattern, but couldn't make the most of the pattern because everything was all scribbled in paper. And then he had reached out and said, hey, I want to upskill myself in data analytics so that I can make sense of this. Because I'm thinking if I'm able to see a pattern, that's him, I'm talking third party. If I'm able to see a pattern, I could possibly reach out to pharmaceuticals to make sense of what the pattern is and see if we can bring in drugs to address this and probably start up a new business, which makes a lot of sense. He's not necessarily looking out to build an entire tech product, but basically see a possible solution in his day-to-day activities that he could also prefer a solution to. And that is one of the ways we need to begin to critically look at how digitizing the system is. We really need to also start looking at the healthcare deliverers. We also had the opportunity to speak with who wanted to upskill their nurses with basic skills on how to navigate some of the solutions that they were given, and also even get access to analytical skill sets that they could apply on the work. However, that's where the conversation of funding really came in. I definitely also appreciate what Edwin said. At the end of the day, you need to also know who exactly is paying. There really isn't much coming in from the government to one of the things that I must say, first of all, is the government has identified the need to educate health workers, as we saw with the case with COVID, having to adapt various ways, like using Instra's COVID-19 tutorial apps to try and educate the health workers on exactly how to navigate caregiving during the COVID period. But there is still a whole lot more that we need to do when it comes to equipping the major players in the system about how exactly to make the most of the tools and the system, the tools, first of all, the systems that are being brought in by digital healthcare innovators. That's what I'll say on the conversation.
Thank you so much for that. I think that you really highlighted some important points. And it's like we've gone back and referenced what Edwin said, like it's always important to know who's paying for it. So I thank you for that. So I'm just going to quickly go back to Ms. Amna. Most of in digital space or tech space, is usually seen as this thing that, the public wants to innovate where the government is lacking, but the government is coming against it. They don't want. So the government is seen as this big bad wolf that does not want progress. So I don't know if you have any insider perspective, how is it on the inside of the government side when from the outside it looks like, the government is, you people you don't want to do the work, the community wants to do it, people don't want us to do it, the government is the big bad wolf. So I don't know if you have, how is it on the inside looking out that people that are saying you don't want to allow progress to come in? So what are the things that usually prevent these innovations from happening, maybe policies that the general public is not aware of, or things that need to be done that are not done, that hinders the government from actually pushing or supporting some of this innovation? So if you have. I'm sorry, if you could unmute yourself. You're quite muted.
Oh, apologies. Thank you so much for the question. So on the government side, there are a few reasons why certain things might not be taken up instantaneously. One, government sometimes looks at the longevity of a project and the ability of it to be sustained. That's something that is always in conversation, the sustainability of a project. Another thing is the actual thoroughness of a project. So there's a lot of concepts that come in, and when they're piloted and in pilot stage, you realize that there are issues with the concept. And so the government in its role has to regulate that and ensure, especially with foreign investment, We have that where sometimes foreign investment comes in wanting to use Africans as guinea pigs, if we're going to be honest. And so it's in the government's role to always ensure, it's looking out for the best for its populace. I know, for instance, we had issues around vaccines and vaccine distribution, and there's always issues around vaccine skepticism, and so it's always on the government, because essentially everything will come back and fall back on the government. When things always go wrong one way or the other, it comes back to the government. So the government in its capacity is, one, trying to protect itself, but also trying to protect citizens in ensuring that what is being tested and what is being pulled out is being done in the right way. And then lastly, it would be collaboration. So there are instances when funding comes in, and funding is coming in from multiple sources. If there's no organizing body or no organizing structure, you sometimes have entities who are unwilling to work with the government because of, historically there are issues of corruption around the government. So there are entities that want to just go solely the private route. But unfortunately, you do have to have some collaboration with the government, because there are genuine workers, like Professor was talking about in his experience with healthcare workers. You're seeing the day-to-day of these healthcare workers, how much effort they're putting, how hard they're working, even in terms of when their infrastructure is not at its best. So you want to always ensure that there's adequate collaboration and there isn't cross-cutting issues, because essentially sometimes when you have all these multiple programs running at the same time, or multiple policies or innovations that are wanting to run at the same time, and they're not aligned, what you do is then you start getting mixed data. You start getting information that might not be accurate. And so the money then you now have to pull out to reinvest to figure out what is actually going on in that situation costs the government a lot. And then there's also the idea that maybe some people in the government, because Africa has a relatively young population. It is estimated that by 2050, I believe, Africa will have over 75% of the population as youth. And so you sometimes have innovation, which is true in not just Nigeria, Africa, but sometimes when new ideas are fielded, and they're met with skepticism, because that is the natural progression of just human logic and thinking. They're sometimes met with skepticism, and there's a lot of things that are considered quote unquote fads. Even when the internet first came up, there was a lot of people that didn't buy into the idea of the internet, buy into the idea that you could link the dial-ups to your house, and so the uptake of some things do have a natural slow progression, and it's not so much that the government doesn't want to see any progress. It's just that sometimes it's a matter of being carried along. It's a matter of sitting down and having these conversations instead of diving in. We see a lot of partners, a lot of funders come in and they just go about their business. The government doesn't exist. And unless you are focusing on a wholly private space where those who partake are 100% knowledgeable of the fact of what you are doing, it is not ethical. It is not right to target low literacy populations who might not be fully aware of what is going on, who might, the benefits might be there, but there might also be costs to them. And so it's a matter of bringing all the stakeholders to the table and ensuring that everyone is on the same page when you go about enacting policies or programs. But yes, certainly the government can do more to open the space, open up the conversations, to allow people to come to the table. So I understand that people might sometimes feel like they can't even converse with the government, so they might as well just do it themselves. So the government certainly should do that. But we're seeing it in Africa. In Southern Africa, we're seeing a lot of mobile health technologies being pushed and prompted, especially for their rural communities. In Uganda, there's a program where almost 30,000 government health workers were trained on medical stockouts, utilizing mobile phones to report on medical stockouts and to ensure that critical drugs such as HIV drugs, malaria medications are never out of stock in regional places. So there is certainly, the government is open to it, and like from what we're seeing, there's a lot of interest in digital tech and digital health in the African space. It's just about all the partners want to be involved, essentially. Everyone wants a seat at the table and they don't want to be pushed to the side.
Yeah, so like I really appreciate that perspective, because it's always different from for the population on the outside looking in. All they just see is this rich country wants to give us money and the government is saying no, they are doing this, they don't want to have that. So it's always nice to hear certain reasons why we can't, just because we have issues of exploitations, like they're willing to give you $10 million, but at what cost are you willing to? So it's good to always hear these issues from the other side. So Safalan, I'm just going to change or sort of reword that question. Same question, but in a different perspective. Like, do you have any experience with maybe policies, government policies that you felt were sort of against any health innovations or innovations in general that you were in? Or how did you feel in that? What was the experience being in that space? Is Mr. Falaby there? Oh, I think he's some issues with that. But if he comes back, we will just circle back with that question. So unfortunately, we have to continue with you, Ms. Samner. You're the only panelist in this session. So the next question is just basically about legal and ethical. I think you've already slightly touched on that, ethical challenges. So private-public interest, I think you've also touched on that as well. But like you said, your views are currently your own. So, but I just want to get if you feel there are certain policies that are not yet in place, but you feel these are policies that can be put in place in the future that can mitigate legal and ethical challenges in balancing that private and public interest. Like I said, on the outside, it's one way, but on the inside, it's the government has to look at certain checklists and make their due diligence. So are there some policies that you think going forward, or you believe going forward, these policies should be enacted because their gain is going to be a lot for the digital health space?
I mean, certainly, yes. So the governments, not just Nigeria, but in Africa, are always talking about ease of doing business. But ease of doing business isn't just by mouth. So we do have to create an environment where structures are in place that you are generating large amounts of investment. And to mitigate the ethical challenges is if these structures are in place, more people are willing to work with the government. And so if the governments have standing policies, like I said, a lot of countries in Africa have digital health strategies. And these type of how to mitigate ethical challenges and legal challenges in public partnerships, in private partnerships, are ingrained in these strategies already, are ingrained in these bodies of work. It's just about implementing it. And to implement it, you have to sort of position yourself as a person, as a leader, or the person who wants these things to come in. So people will have these conversations and bring you to the table. So in terms of policies, I would say certainly, in research, we have just like the US has IRB review, we have review processes to conduct research in Nigeria, to conduct human trials, to conduct all of these things, to do surveys. There's a lot of review processes that go into that. But if these review processes were streamlined, they were easier to understand, and then we would be actually helping those who are in it for the good. As a private organization, it is certainly within your purview, and it's certainly all right for you to say you're in this for profit. That is not a bad thing. If you're a private organization, this just happens. The side effect of your money is that it is not bringing good. You're in this to make money, and that should not be something that should be looked at as a bad thing. And so I think the government being able to work with these organizations by enacting what is already in our digital health strategy, ensuring that there's no loopholes, to your policies and your strategies. Corruption plays a massive role in so many countries. If someone can just pay their way around doing what needs to be done, then that's how you get get into the ethical challenges. But in the space of digital health and tech and investment and actually venture capitalist funding, a lot of people are very much willing to, as long as it's making them money, do good. And so we shouldn't overlook that. We shouldn't always frown upon the fact that he's making money, so what his intentions cannot be pure. And so it's to weed out those ones whose intentions are not good. And that can come from rigorous review processes that are streamlined, though, that are making it easier for these things to get caught and be flagged. And one important, very last thing, and this is something I'm personally very passionate about, monitoring and evaluation. I love monitoring and evaluation. Anyone that talks to me, I will always include it in any subject. If we can monitor our programs, if we can monitor, if we have robust M&E frameworks where we are monitoring programs, where we're monitoring public and private partnerships to ensure that, you know, these targets and these deliverables and these promises are being met, then before you reach a state where it becomes ethically an issue or legally an issue, you catch on to these things and you can stop them and you can put these stop gaps in place by doing that. So we really need the government to push more for M&E frameworks, to push more for the standardization of things that are already in text. And Mr. Falabi, we lost you for a little bit, so Naomi, you can go back to him.
So she had to stand in your place, but a very good stand she has given. So because you really raised some really good points from the government's perspective, and like it has given us a chance to sort of see through the government's eyes that it's not just always about, oh, we don't want to do it, but there are checks and balances that need to get done. And granted, it might not be the quick fix, and just accepting the money and saying, okay, thank you for your money, go on and experiment on our population. But there are things that need to be done to ensure that even though we do engage in these partnerships, it is for the betterment of all the parties involved. So thank you so much for offering your opinion, personal opinions, as you have given a disclaimer to, personal opinions on what we've had to discuss today. So I'm going to go back to Mr. Falabi because you have questions to answer. So before we lost you there, I asked if you had experience in a space where you had innovations that you wanted to implement, and then it felt like the government policies were sort of against or for. Like, how were the policies when you experienced or when you were in that situation?
Okay, thank you very much. So I wouldn't say I directly have this as a developer, but as a solutions business developer who sells software solutions in healthcare. A couple of things that we've had as challenges that we've observed while going through the space of designing the solution we have is the delay in response. It takes a lot of time, and I really appreciate that Amna actually made mention of that. It takes so long to have response from the government when it comes to walking through meeting all the regulatory requirements. And typically find that while we are trying to get the local process done, you see that we are also looking to collaborate with international regulators as well. I mean, you typically find Nigerian companies also trying to register abroad and have like EPA, being settled with EPA as well, so that we can get access to international fundings. While I'm in a better place right now, I'm just an enthusiast, really wanting to build things, and I'm working with people who really want to build things. I enjoy the fact that I'm able to understand from Amna's perspective on what the challenge is. However, it would really be great if we see, specifically speaking about Nigeria, we see how the government is actively moving to reduce the process of businesses being initiated, registrations and all that. Can we also have that being accelerated also in the health, the digital healthcare growing industry? It will really help for us to accelerate how solutions are being designed and implemented. Because what you also have to understand is that for those who design this product, time is of essence, and it costs a whole lot to run technological solutions. All right, and the time that we spend empowering infrastructure means that we burn out of cash pretty fast and doesn't allow us to see if we have something doable to scale. So time is really of essence. Thank you.
So yeah, thank you for that. And I'm sure if she probably, or I hope she will take that to well, yes, will help that be improved. So we've talked about, yes, your experience and policies that you felt like had an impact on innovation. So just quickly, the last question is, are there some policies that you would like to see implemented that can, mitigate like some of the problems that you've encountered in maybe legal and ethical challenges implementing innovations, digital health innovation? So are there some policies that you would like to see or that you feel would make the process faster, or something that you feel is something that's within the purview of the government that they can do as well? Because you also have to know that they have their own checks and balances to do. You have done your checks and balances, you have brought the product to them. It's now time for them to do theirs. So are there policies that you feel can be enacted to like make this private, public, this government and in tech or situation, this ecosystem, are there policies that you feel can make this partnership better and like work more smoothly?
Okay, great. I would say some things, and I'd also appreciate if Amna can corroborate if they exist or do not, and it's just pure out of my own ignorance. So one of the things that would be interesting for us is access to data. I know one thing that the government does really strongly is collaborating with developmental organizations that, just like, I can't remember who said it on the call, we really get a lot of funding when it comes to running health intervention projects here in Nigeria. However, there is what happens afterwards, how much of that information is easily accessible. Innovators need to be able to have access to this kind of information to further tailor down and really not waste time on please confirm if you can hear me.
Yes, we can. We lost you for like a millisecond, but we can hear you.
Yeah, the ghost of the internet won't get me. All right, so that, for instance, would be a conversation that we definitely need to have. In all, one thing that we've always had conversations around is when we have, because we know a lot happens when developmental organizations come in a partner with the government. And we also want to be part of that conversations, because a lot happens for us as we could be the partners that perform implementation. There is a whole lot that we can reach, and it would be great if we can be brought into the conversation, say maybe a third leg to the strategy with which the government uses to address certain public health matters. So innovators aren't outliers in the conversation. Innovators want to provide solutions. So it would really be great if we're considered as part of the equation across all the various strata of the healthcare system. Thank you. Oh yeah, and I also said, if I was saying something off, I'm not, correct me if it's existing, if it's not. Yeah.
So I'll briefly respond to that in the sense that, yes, I certainly understand, because when we bring stakeholders to the table, innovators are missing. And so that's something that's a gap that should be addressed in the healthcare space. I specifically work in the HIV space. So we have a few funders and a lot of implementing partners. And so when creating concepts, you want to include innovators in that in that, instead of coming to them as the end user and say, okay, we've created this concept, it is now your turn to implement it. Certainly, and data is actually a very contentious thing, because that's what we're pushing for, getting access to data. So the government has access to its own data. All the IPs that we work with reports to us. For instance, there is a national data repository for HIV, but it is missing data from military, for instance. It is missing data from private facilities. And so if someone is coming in and you're looking at a good chunk, 20-30% of your population data isn't in this repository, how are you going to go about it? And unfortunately, there are no structures in place to compel private organizations to do things like hand over data, especially when it pertains to health data, because there is legal backing for protections of health data. And so that's something that, private entities and governments need to sit down and look at that and say that, for the good of the nation, we need to start coming together and collaborating and, having data repositories, having databases that are publicly accessible, obviously de-identified, but publicly accessible, so that, more research can go into it, more evaluations can go into it, and then more, concepts can be created off the backs of those data.
Yeah, I hope she was able to say something that's okay. So thumbs up for that. So I think most of everything that we've said can traverse across the countries in Africa. So it's not just a Nigeria thing, because Africa as a whole, if the whole concept of NGOs is like they thrive here, because this is where they feel most of the underserved population in the world is. So if we're going to enact digital health solutions here, there's also need to have governments across all different countries on board, and then working in partnership with people that want to implement these innovations. So a very big thank you to our both our panelists, Amna and Mr. Folabi. Thank you so much for lending us your time and your expertise. I'm sure there are some questions, because I've been seeing them popping on my screen, but that section of this portion, as we begin to round out the whole webinar, is going to be handled by Lovia. So I'm going to hand the reins back to Lovia. Thank you guys so much for joining us. It was grateful to have you.
Thank you for having us.
Wow, thank you very much. Now, let's give a virtual clap to this panelist and our wonderful moderator. Thank you very much. I actually didn't want it to end, but everything that has a beginning has an end. So we would wrap up. Unfortunately, because of time, I would allow just 2 questions. So kindly raise up your hand if you have a question to either the first panelist or the second one, and then I'll call you. We'll give you the opportunity to ask your question and have an answer. I think for most of them that were put in the chat, they were answered by the first panelist. And so I think I saw a hand, if I'm not mistaken.
I think I'm seeing someone's question. I'm not sure but I'm just going to ask it. So the person is asking how, and is directed to Amna, is asking how the government is addressing, if the government is addressing, and if they are, how are they addressing digital literacy in the elderly and the youth of Africa? I know digital health policy is not your forte, but if you are aware of any, or what the government is doing in the HIV space, as you said, concerning digital literacy in the elderly and the youth of Africa, maybe you can just shed light on that to help.
All right. Thank you so much, Dr. Geddes, for that question. So there is a lot being sort of done for digital literacy, particularly for the youth. Unfortunately, for the elderly, not so much. But for young populations, there are programs set up by the government that are pushing towards digital literacy and digital knowledge, particularly in private partnerships with the government and private universities, but also even in Nigeria in the NYSC scheme. I know the NYSC scheme has a lot of training classes, and one of the main training classes they do is computer literacy, knowledge sharing, and social media management, because as we're seeing, a lot of young people are popping up as social media managers. We're trying to, even in my agency, push towards social media rebranding, and so you get the push around people understanding and knowing, how to work with technology and how it affects their health, and the things that can be done around that. So that's something that's certainly in the conversation, and it's certainly something that should be more robust. I know the Africa CDC as a whole is also working aggressively on that, but like I said, the gap now remains with the elderly. For the youth, it's certainly easier because just it almost comes naturally to kids these days. They're born with an iPad in their hand, and so that the understanding of technology isn't something that is lost in them. I have nieces and nephews that are to typing and being able to open YouTube and search videos by themselves. So certainly that information just needs to be put out. And it can be accessed by the young. And then for the elderly, I know they're in Kenya. I read about this pilot program around mental health where, young people were trained to discuss with the elderly on how to reach out to use mental health services. So an almost sort of like generational crossing. And so I thought that was a very cool program that was being implemented in Kenya. I wish I had the link. I would have posted it in the chat.
You can always share with us later. Yeah. Thank you very much for that. Do you have, shall we take our last question?
Yes, so someone else has the question. So I think Mr. Falabi will be able to answer this one.
Okay.
So the person said, please, can we shed more light on beliefs and perception and willingness to pay for digital health in Africa and much more West Africa that is plagued with a lot of health issues? So is that perception of having to pay for healthcare. So if you can just give your thoughts on that.
Is that one for Prof?
No, for Afolabi.
Oh,
yes.
Okay.
Okay, so the question is saying if Africans are willing to pay for healthcare services. I mean, one of the things that has been happening so far is that there has been a continuous, especially because of the major players in, say, Nigeria, for instance, because it's Nigeria's market I'm familiar with. You have a whole a continuous drive with more and more players in the insurance space, especially the health insurance space, who are consistently, first of all, educating the market about the necessity, the need for such kind of insurance, which is really the main part for Africans, because Africans typically have a self-governance, approach to sustaining themselves, where you provide your electricity, your lights, your own protection, etc., etc. So it's tough for you to come through and say, hey, we want to build a system that ensures that you can be adequately taken care of when, in case anything happens. However, there is the path of continuously sensitizing the market about the necessity for these things. Another thing that has also happened is that it has moved from the place where it was for the premium markets, now cascading to, say, the middle income class folks, and now also moving down to being affordable for as much as 3,500 or some even lesser, per month. Which is typically in Naira, at least, for all the nationalities who are on the call. So, and I think in the current exchange of about, say, 550, that should put it roughly under $60 or $6. Is it $6? Okay, yeah, around $6 thereabouts, a month. So, and for an average person who earns, say, 150, could consider it, that could be a path. And we have you could see with the trend of the players in this space, like you have the Reliance HMO, who are consistently growing in numbers of subscribers. and especially with the consistent communication about the reality of healthcare in the country. I think two major things that have happened is the continuous education of the markets that played a very pivotal role in ensuring that we have more persons who are encouraged to take up these offers. And the second thing that has happened is more stories are being told about the benefits of taking up these offers. So we do have more people who are considering taking advantage of these opportunities. Also, because there is a boost in the startup community across the African countries, and these guys are trying to meet up standards with how they employ the staff. And so this comes along with the package. You're having those kind of partnerships, ensure partnerships between the startup community and the service providers, being able to provide such kind of facilities to their employees. So I believe those are the kind of things, those are the two things that I perceive as what has encouraged more customers paying for healthcare services.
Sorry, I was muted. Okay, thank you very much. Wow, I can't believe we are gradually drawing the curtains. I'm really enjoying the conversation and I don't want it to end. Thank you so much. This is one of the most wonderful, insightful discussions that I've had about digital health so far. Thank you very much to our panelists. I quite agree with all of you, from Prof, Mr. John, Mr. Ajogun, and everyone, Afolabi, Amna. We are very grateful for you all coming on board. And it's very impressive to see how you're all driving a change in the healthcare industry. We hope to, have you in our next meeting. So I would hand over to our lead researcher, Dr. Festus, to give us the last words while we close for today. Doc, over to you. I know I'm putting you on the spot.
That's all right. Thank you very much. Thank you. Thank you very much. We can't exhaust gratitude to our panelists. Really, we can't say thank you enough. Mr. Enoch Afolabi, thank you so much. Such a very, very brilliant mind. I revere you and I really respect your contribution today. Thank you. Amna, in fact, you've blown us away with all your wonderful contributions, and our Twitter page is just boom, 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 posts everywhere. Thank you so much. And to Professor Mamadou, I think in absentia, I think he left. John as well, I had to attend to something. Oh, I think John is still here. Thank you very much, John. We will really appreciate your time.
Edwin,
and
Mr. Jogo,
Edwin, yes, Edwin. Oh, the great innovator. From you can check out Eco Innovation Center. These are the guys behind the Nigerian money, the national cake. Thank you very much, everyone. It's been a pleasure. We're very grateful to all our panelists and to everybody for joining. I've never seen people stay this long for such a discussion like this. People just drop out. I think on average we have probably roughly 60 people coming and going in. So that's very encouraging. We'll be having our next country in focus webinar in May. We're looking to dive into the 54 countries in Africa, just going deep into the health sector and partnering with people there. So we look forward to seeing you all again. Thank you very, very much, and have a wonderful rest of your day. We're still just gonna hang around. If anybody wants to stay back and just have a chat, that's fine. But I will stop the recording now. Thank you very much. Thank you.
Okay. Thank you
for
very
networking.
Much.
Yes, for networking and yes. Thank you.
Okay. All right. Thank you. And for those who kept our chat interactive, we are very grateful, Dr. Gedes. Thank you, Sharif. Thank you, and all others that I didn't see who kept interacting.